Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Justin Collier. He's healthcare CTO of North America at Lenovo, Chris Miskell, CEO at Versiti, and Lynn Briggs, CIO at Versiti. Welcome.
Thank you.
Thanks for having us.
Yeah, excited for this discussion. I appreciate you coming out during the busy CES conference to talk with us. But let's dive in and learn a little bit about you. Chris, why don't you start? Tell us about yourself and Versiti.
Sure. Yeah, my name's Chris Miskell. I've been with Versiti almost 9 years now. Worked in healthcare for 20 years prior to that at a couple of large companies. And I'm really passionate about our nonprofit mission. Versiti's been around since 1947, and the Articles of Incorporation said that it would provide a sustainable blood supply and also advance blood research.
Wow.
And so to this day, 78 years later, we're focused on doing just that.
78 years, wow. And what an important work. I appreciate that. Thanks for doing that. Lynn, how about yourself?
Thanks. I've been with Versiti about 20 years.
Okay.
And I've been really privileged to watch Versiti literally triple in size.
Wow.
And literally triple the number of service lines and things that we do to better patient lives. So I really do feel honored and blessed to have been able to contribute to that from the IT side.
Yeah, I can't wait to hear 20 years of tripling the growth, and technology's changed a bit in 20 years too. So I'm excited to hear about how that's evolved for you. Justin, how about yourself in Lenovo?
Sure. So I'm Justin Collier. I'm a physician, clinical informatician, and technologist. I serve as the healthcare CTO for Lenovo North America, which means that I get to work with our fantastic, some would call them customers. I'd like to think of them as partners, to really advance healthcare delivery, improve health for all of us, as well as improving the experience of those that are delivering that care or working with those patients.
That's awesome. Well, Chris, I love having CEOs on here because you're not a tech nerd like myself and the other CIOs, right? But I'd love to hear, how do you look at technology when it comes to your approach to innovation?
Yeah. Well, as a nonprofit community-based organization, we're here to serve others, and we have two rallying cries. One is that we're saving the lives you love, and the second one is that we research cures. And so for me, our technology roadmap is aligned to trying to elevate those two things. Across the Midwest, we serve over 400 hospitals, and every day there's someone in those hospitals that needs blood. We take it extremely seriously to make sure that we deliver for them so that they're there for their families. So for me, partnership with Lenovo has been so wonderful. I think the first asset that I got when I started 9 years ago was my Lenovo computer.
That's interesting. Your first memory of starting was your laptop.
And it's an important thing. A lot of good work. Well, I like to believe a lot of good work happens in that laptop. But it's symbolic for partners that are mission aligned with what we do and want to lean into not just the transactional side of the partnership, but figuring out where we can advance our mission.
That's awesome. Lynn, I'd love to hear what some of the unique realities of doing IT at a blood bank are and being able to fulfill the mission that Chris talked about, because we've had a lot of health systems providers. Some of them have blood banks and whatnot, but the fact that you're a blood bank, what are some of the unique realities you face from an IT perspective?
Sure. I think we treat our donors like they're a patient as well. And so the donor is center to providing that life-saving mission. So there are unique aspects of we need to go to them. So unlike coming into maybe always a brick and mortar facility where you have complete control of that IT infrastructure, we're having to go out on the road via vehicles, set up in unfamiliar locations. And now, honestly, Lenovo being a great partner has helped us think about the technology that we use, because it needs to be rugged, but it also needs to be easy to set up. We have hourly staff, hourly phlebotomists. We can't have technology get in their way of interacting with the donor and giving them that experience. So it's a very unique, almost military operation every morning to pack those folks up, get them out there, and make sure everything is working and that part of the process is not in their way.
It's like the COVID experience year round is what you just described, I think.
Exactly.
Every hospital for COVID had to roll up all these things like you just described. You're like, wait, no, that's every day for us.
Right. And I think, again, and then making that experience once that donor is working with us, whether they're maybe in a Lenovo office facility and we're collecting there, making that experience seamless for them, and also having data available. We know who you are when you came in the door.
That's interesting. You know, you just mentioned one IT infrastructure challenge, which is mobility and things like that. Justin, what are some of the IT infrastructure challenges that you see that maybe not enough people are talking about, but they should know about and be addressing?
Sure, I would say the pace of change in technology makes keeping up a very daunting task. So being prepared for that. And one of the other things that we're actually starting to hear a lot more about, and that I expect we're going to hear a lot more about over the next few years, is there has always been more of a thought of how long do we have to hold on to our data based on regulations and other drivers, to now that we have the, data's the new oil has been said for a while.
Sure.
But now AI is the refinery. So now that we can actually turn that data into meaningful insights, into meaningful results, meaningful research outcomes in a much more rapid way than we've ever had the power to do before. The conversations about how do we hold on to more data and do it forever. So that thought around data governance, data storage is becoming more and more important. And I think something that if your organization's not talking about today, probably is something that you should be thinking about very, very seriously.
Interesting. Lynn, I'd love to hear from your perspective. You know, you could talk about the data, but also, managing your laptop and desktop infrastructure to make sure that Chris can do the important work that he's doing, right? Like, what are some of the challenges that you had, and how have you worked to kind of address those challenges?
Yeah, I would say for Versiti it's a little bit unique in the sense that the spread of what we cover in terms of IT. And so we talked a little earlier about, going on the road and trying to just collect blood products. That's a use case for us. We stretch all the way to high-end research. So balancing all the planning and ecosystem that needs to come together, and be honest, it's a nonprofit. So there's a level of limit to our budget compared to someone else. So our ability to be agile, have partners that help us plan out those ecosystems, but we also connect the data from all of those different service lines back into a core. And so I think it's got to be retained, stored, accessible, understandable. So that challenge of saying we don't view the data that we collect or what we do as siloed by service line, but we see that as an ecosystem of data that can be used for various types of discovery. So it's a lot to take in, but that spread of Versiti is an entity that is extremely unique in our space, does drive a lot of our IT and what we worry about and how we begin to approach problem solving.
Yeah, that's interesting. I mean, you both talked about data, and I think the thing that we're hearing most about tied to data is AI. I mean, it's all over CES. Is there any non-AI companies here? I guess there's a few phone cases, but other than that, it's AI bonanza, right? And Chris, I'd love to hear how you think about AI and what your perspective is on AI, and how you see it, how it's going to impact your business and how you're going to leverage it to better serve both the donors and, of course, the health systems that need the blood.
Yeah, well, we certainly don't have it solved, so the jury's out. But I think that innovation and productivity are a couple of places that we're focusing initially. I'll give you one example. We recruited a scientist from Florida a few years ago that's a bioinformaticist. And really what she's trying to do, one of her first disease states she's focused on is acute myeloid leukemia. And she's taking large data samples and applying AI kind of algorithms to try to figure out better treatment and kind of, first of all, a more precise diagnosis, and then what the implication is for treatment for that. So, one of the beauties of our research institute, it's the largest blood research institute associated with the Blood Center in the United States.
Amazing.
And so we're really fortunate to, back to those 78 years that we've been around, there's been some real heavyweights in blood research that have walked through the doors and kind of set the frame for the quality of research that happens. So, on campus, we're kind of situated next to Medical College of Wisconsin, and our folks kind of flow very naturally, literally kind of sharing underground tunnels, et cetera. We've got a level 1 trauma center. We've also got an exceptional children's hospital. So I think technology can play a role and does play a role in connecting us together on behalf of the community and patients. So that's what I would say on the science side, and there's probably more that we can do there. On the blood donor side, everything as simple as chat. If a donor wants to come and kind of they have a question about blood donation, can we make that really simple? But we're also trying to figure out the donor experience, and we have over 300,000 blood donors in any given year.
That's amazing.
It's a big enough data set that we should be able to apply some algorithms and figure out how we can be a little bit more donor centric in our outreach and our inspiration to get them to stay connected to our mission.
I don't know if I should confess this on camera, but I used to be a regular blood donor, but then I stopped. I just got busy, and I haven't heard a word from them. So yeah, there is a big opportunity there, right? If I got the right message, I probably would go do it again.
That's right.
But I just haven't, and so I'm sure there's plenty in your population that are like me in that situation. So I love that use case. Justin, AI is the buzz, right? We're hearing all about it. Lenovo's talking a lot about AI. What are some ways that you're seeing AI kind of move past that buzz and really make an impact, kind of the way he described?
Sure. Productivity was a great call out there. Offloading some of those mundane tasks that take humans away from value add in their day, I think is one of the great areas where we're already seeing just tremendous progress. For a hospital health system, it could be on the documentation side of that clinical encounter. For other tasks, it could be engaging with insurance, for example, and other things like that that are sort of those repeatable, really mundane tasks that just take up time.
Yeah, absolutely.
Being able to automate many of those things, I think, is a huge benefit. There are so many others. Oh, wild. But thankfully, healthcare has been on the forefront of using AI in the research environment for quite a long time. It's not a new science to healthcare. Now, there are new forms of AI, new technologies that drive it and make it much more effective, much more impactful, much accelerated. But seeing how it is changing what's possible to do research on and the rate at which those discoveries are made, that's so exciting.
Yeah. Lynn, what would you add on the AI perspective? Or are there other IT projects you're working on that excite you that maybe aren't AI? Yeah, I'd love to hear any of those as well.
There are so many. I did want to just apply AI a little bit even to cyber, which I think we tend to overlook it.
That's a fantastic call.
Well, the hackers are using it. We
Absolutely.
better use it.
So absolutely. And I was, Versiti was an early entrant into using AI to actually start to monitor what's happening, and is just something not look normal. So I don't want to take our eye off the ball that we have to still protect everything that we're doing. But I think there's some exciting things that I think Chris hit on it with analyzing our donor base and looking at those demographics carefully and using AI to also run that against our messaging, adjust messaging quickly to say, this demographic is going to respond and understand this explanation differently. So how do we quickly tune even how we communicate? If we call, because we still call, all of that needs to be tuned to the individual. So I think creating that personalization using AI is going to be critical for what we do. And then to Chris's point, as we go to the research end, it's frankly an expectation of the NIH. It is expected that we will speed the time from discovery to cure using AI and other technologies.
Wow. That frames it perfectly, right? I hadn't thought about how that is going to become an expectation. If you want funding, you better use AI.
Correct.
Would I fund you if you didn't? That's interesting. Well, as we wrap up, Justin, what else is happening at Lenovo that excites you? Lots of big announcements here, lots of interesting chips and things.
Sure.
But what would you mention as we wrap up?
I'll give you 3 or 4 quick things that I think are super exciting for me, for the impact that it'll have in the healthcare ecosystem. One that's not AI is digital twin. We talk a lot about that, but Lenovo is really leading the charge in a lot of ways to apply digital twin technology to solve a lot of healthcare problems. Whether that's looking at a digital twin of a built environment or looking at a digital twin of a patient or an organ. But being able to do both simulation and monitoring through that digital twin technology is really, really powerful. Virtual reality, we're doing a tremendous amount with, I should say extended reality, because it could be virtual or augmented.
Sure.
But all of those technologies that make up extended reality are extremely exciting, whether they're for therapeutic use or educational use, or just a distraction while you're going through something that's maybe uncomfortable or lasts a long time that you can't do anything else. We are seeing that play a neat role in a lot of different ways throughout the healthcare ecosystem. And then finally, it's going to sound a little silly. You know me, I'm a gamer myself. So the gaming part of what we do is really exciting too, but it's not for me as an individual, although I love that. But it's for entertaining patients while they're in an environment for an extended period of time, giving them a better experience because they're able to play the games they know and love, maybe even on their own account, while they're otherwise going through something that could be unpleasant.
Yeah. I think he just gave you a new idea. Gaming while I donate. Is that what I need?
That's what we need.
I like this idea. That would be an easy way to get me and my kids. I mean, they would love to be going and donating and gaming at the same time. That sounds really good. Well, Justin, Chris, Lynn, I appreciate you taking time to talk with us and share kind of your experiences with this quickly evolving world of technology and AI. So thanks so much for talking with us, and thanks everyone for watching and listening.
Yeah, and donate blood today.
Yeah, for sure.
Thanks for having us.
If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks.
Thank you.
Thank you.